Hello, everyone. My name is Gabe Capote, and I am the Chief of the Policy Unit in the Provider Enrollment Division at the Department of Healthcare Services. I'm also joined by Spencer Halsey, Chief of the Policy Administrative Branch in PED, Katie Holtzen, Chief of the Policy and Enrollment Processing Section in PED, and Caitlin Rojas, an Analyst in the Policy Unit in PED. Thank you for joining us at today's stakeholder hearing. We will be discussing the draft regulatory provider bulletin titled Updated Medi-Cal Requirements for Ordering, Referring, Prescribing Providers, Forms, and Procedures. Please note, the purpose of this hearing is solely to discuss the updates to this bulletin. The July 23rd effective date refers only to the effective date of the technical wording update in the draft provider bulletin. Caitlin, can you confirm that you can hear me?
I can hear you, Gabe.
Okay, just making sure. I'm going to restart right there. So please note the purpose of the hearing is solely to discuss the update to this bulletin. The July 23rd effective date refers only to the effective date of the technical wording update in the draft provider bulletin. It is not an enrollment deadline, and it does not signal any change to billing or claims processing. Claims will not start denying on July 23rd. Implementation enforcement will begin later this year, but will not begin in July. Additionally, questions related to billing, rates, or managed care will not be addressed during the hearing. For inquiries unrelated to the bulletin updates, please email DHCS PED stakeholder at dhcs.ca.gov. Now we will go to Caitlin to go over the agenda, reminders, and bulletins.
Thank you, Gabe. Good morning. My name is Caitlin Rojas, and I'm an analyst for the Policy Unit in the Provider Enrollment Division. Now we will go over the agenda, reminders, and bulletin. The purpose of today's hearing is to provide you with an opportunity for discussion of the draft provider bulletin. For our agenda today, we will go over some reminders. Then we will provide a bulletin overview and review the updated Medi-Cal requirement. Lastly, we will end with comments and questions. Before we begin, I have a few quick reminders. If you're experiencing any technical issues, please email DHCS PED stakeholder at dhcs.ca.gov for assistance. Please hold all comments and questions until the end of the presentation. We will have plenty of time for comments and questions at the end. Please be sure to send any questions or comments made in the chat box to everyone. We will discuss this in further detail at the end of the presentation. Only written comments received by email by 5 p.m. today will be considered prior to publication of the final bulletin. You may send your written comments to the following email address: dhcsped stakeholder at dhcs.ca.gov. When submitting your comments, please make sure you reference your name, organization if you're affiliated with one, and the bulletin title. This hearing will be recorded and posted on our stakeholder hearing information webpage for future reference at a later date. We will provide a link to that webpage in the chat now. We will now go over the bulletin. The Department of Healthcare Services, DHCS, is implementing updates to the Medi-Cal enrollment requirements for ordering, referring, and prescribing for providers to align with federal guidance and regulations. In accordance with the Centers for Medicare and Medicaid Services, CMS, DHCS is updating existing requirements for the enrollment of ordering, referring, or prescribing only providers in the Medi-Cal program in accordance with 42 Code of Federal Regulations, CFR, Section 455.410, and 42 CFR, Section 455.440. These requirements are necessary to comply with the February 2nd, 2011 final rule published by CMS in the Federal Register. 42 CFR Parts 405, 424, 447 et al. 76, Federal Register 5862-5971, which implements provisions of the Affordable Care Act, ACA, of 2010. As a reminder, The draft provider bulletin was attached in the stakeholder hearing invitation email that was sent on May 26, 2026. It can also be found on our stakeholder hearing information webpage, which we will provide a link in the chat now. Now we will go over the updated Medi-Cal requirements. Effective July 23rd, 2026, DHCS has updated this bulletin to clarify that providers enrolled in Medicare must also separately enroll in Medi-Cal, and providers can enroll using the department's electronic enrollment system. As a reminder, the July 23rd effective date refers only to the effective date of the technical wording updated in the draft provider bulletin. It is not an enrollment deadline, and it does not signal any change to billing or claims processing. Claims will not start denying on July 23rd. Implementation/enforcement will begin later this year, but will not begin in July. Specifically, providers who only order, refer, or prescribe services to Medi-Cal members will need to enroll in the Medi-Cal program. These providers do not send direct claims to Medi-Cal for the services they furnish. There are 3 basic requirements for ordering, referring, or prescribing for Medi-Cal members. The physician or non-physician practitioner must be enrolled in Medi-Cal. The ordering, referring, or prescribing provider National Provider Identifier, NPI, must be for an individual physician or non-physician practitioner, not an organizational NPI. And 3, the physician or non-physician practitioner must be of a specialty type that is eligible to order, refer, or prescribe in accordance with federal and state laws and the Physician and Non-Physician Practitioners Practice Act. If the provider is not currently enrolled in Medi-Cal as an individual with their Type 1 NPI, and they wish only to be able to order, refer, or prescribe items or services for Medi-Cal members and not seek reimbursement for services provided directly to Medi-Cal members, they must enroll as an ordering, referring, or prescribing only provider. If the ordering, referring, or prescribing provider's name or NPI on the claim of the billing provider is not enrolled in the Medi-Cal program, the claim will not be paid. Enrollment in Medicare alone does not meet this requirement for participation in California's Medi-Cal program. In order to enroll in the Medi-Cal program for the sole source of ordering, referring, or prescribing, providers must submit an electronic application through the online provider enrollment application system, along with all supporting documentations. Providers can access Medi-Cal provider enrollment information on the DHCS Provider Enrollment Division webpage. Now I will pass it to Katie for the comments and questions portion of the hearing.
Okay, good morning, everyone. Again, my name is Katie Holton, and I am a section chief with the Provider Enrollment Division, and I'm going to be answering any questions that stakeholders have. Thank you for listening to our presentation about the Regulatory Provider Bulletin titled Updated Medi-Cal Requirements for Ordering, Referring, Prescribing Providers, Forms, and Procedures. If you would like to share a comment or ask a question, you may either raise your virtual hand or type it in the chat box. Please send any comments or questions made in the chat box to everyone. I'm going to go through the chat box first. Then if you have your virtual hand raised, we will unmute you individually and you can ask your question verbally. Okay, so I'm going to start with the chat. Okay, so Alex Saldana asked, before this July 23rd, 2026 date, what was the requirement? And so before the update to the bulletin, with us making the technical clarification, the underlying requirement has been in place since 2013, and it's the same now. Federal and state law require that any provider who orders, refers, or prescribes services for Medi-Cal members must be Medi-Cal. Our existing bulletin incorrectly stated that Medicare enrollment as an ORT provider was sufficient, and that's not correct. So we are aligning our bulletin to comply with federal and state requirements. Next question. Let's see. Joe Turner asked, these slides are very useful. Will these be available to us after the meeting? Yes, they will definitely be available. There's a webpage on the Provider Enrollment Division webpage that shows stakeholder hearings. And so you can find a link to it there. And it will also share it by listserv. Okay, next question. For providers who are already enrolled as ORP and wish to transition to becoming a Medi-Cal provider for reimbursement, what is the process for that? You would submit an application in the provider application and validation for enrollment portal as the provider type that you would like to enroll as. Let's see, so next question, how long does it take to be enrolled as a Medi-Cal provider? So we have statutory timeframes for all provider types. For physicians, surgeons, osteopaths, we have a 90-day limit to process those applications. For all other providers, it's 180 days. We try to make it as quick as possible, but those are the statutory timeframes for enrollment. Are established Medi-Cal pharmacy providers required to enroll directly with Medicare CMS? If a Medi-Cal pharmacy provider wishes to provide services to Medicare members, then they would need to enroll separately with Medicare. For associate providers, does the supervisor have to be enrolled? Yes, the supervisor does have to be enrolled if they're listed on the claim. Next question from Allison Livingston. Can I confirm that only licensed providers and not trainees need to sign up as a provider with Medi-Cal? Correct. That is correct. Associates and trainees do not need to enroll as ORP providers. Only licensed and fully licensed individuals. And then the rest of the question was, for example, LCSW needs to be enrolled, but not MSW trainee working towards licensure. And yes, correct, Allison, they would not need to enroll. Okay, let's see. Next question from Laura Velasquez. If already enrolled in PAVE as ORP, where do I enroll in Medi-Cal? You would also enroll in Medi-Cal in PAVE. So this isn't a separate, there isn't a separate portal for ORP enrollment versus some folks will call it straight Medi-Cal enrollment, fee-for-service Medi-Cal. It's all in PAVE. So if you are currently enrolled as an ORP provider and you would like to transition to full or straight Medi-Cal, you would also submit an application through PAVE. What will the enforcement deadline be? We don't currently have a time frame for the enforcement deadline, but we do want to make it very clear that July 23rd is not the date that claims edits will begin. You are also not required to enroll by July 23rd. That is just the effective date of this technical update to the bulletin. Okay, so May Wang asked for the PhD, LCSW, LMFT, and LPCC. Will they also need to enroll as ORPs or they need to be enrolled as fee-for-service? That depends on how they would like to bill. If they would like to bill directly, then they would need to fully enroll in Medi-Cal. If they are only ordering, referring, prescribing, then they would need to just register as an ORP provider. Does this apply to FQHC providers? Yes. So any provider that is ordering, referring, or prescribing for a Medi-Cal member, regardless of where that's at, if they are not enrolled, they need to be enrolled if that claim is going to be paid. Okay, next question is from William Barcelona. If our organization utilizes non-enrolled provider specialists that are under a letter of agreement for a one-off treatment of Medi-Cal beneficiary, will this no longer be permitted? William, I would like to take that question off the air. So if you could please send an email to DHCS PED stakeholder, we would be happy to route that to the appropriate division for response. Dawn asked, we are an FQHC and enroll all providers in PAVE as ORP. So we are doing this already. What is the process for re-credentialing? If any of the providers that you participate with or list on your claims are identified as needing to be revalidated, then they will be notified of revalidation. There isn't a specific process for re-credentialing. I can't say that word. Re-credentialing. Next question is from Bruce Adams. Will there be a functional search of the PAVE portal so that organizations can monitor and confirm compliance? So there is actually not a functional search within PAVE portal, but you can very easily confirm the status of a provider in the fee-for-service open data portal. I think my staff will, if they haven't already, could you guys share a link to the open data portal? You can check by MPI and confirm the status of a provider there. Okay, next question is from Jenny. For organizations like FQHCs, is there a provider lookup tool? Yes. Or report available to verify whether a provider is currently enrolled in Medi-Cal as an ordering, referring, prescribing provider before enforcement begins. So yes, as I just stated, there is the fee-for-service open data portal. Yeah, there it is there. So it's been shared in the chat, but folks can check status there for providers prior to enforcement. So next is Priska. I apologize if I'm not pronouncing that correctly. We have some residents in a teaching facility providing care to patients, but services are billed under a billing position. Do residents need to be enrolled as ORF or just those billing providers? Residents hold a student NPI and not yet licensed physician. It depends on how they are licensed, but typically no, the resident, or I can't remember. I'll need to take that off the air, I think, and confirm the resident part of it. So if you could please email DHCS PED stakeholder, that would be great. Okay. Next question is, if a provider's type 1 MPI was enrolled with a previous practice, is any update needed? No, if they were enrolled as a rendering provider and continue to be enrolled as a rendering provider, then they would not need to enroll separately as an ORP provider. And the same would go if they were already enrolled as an ordering, referring, prescribing provider, they would not need to enroll again, as long as that enrollment was with Medi-Cal and not Medicare, to be clear. Okay, next question is from Liz. For Medi-Cal billing, for nurse practitioners enrolled in the PAVE portal, are they restricted to submitting claims under a single enrolled supervising provider, or are they permitted to bill under multiple providers within the same Medi-Cal group? So that's a billing question that I prefer to take off the air. If you could please send that to DHCS PED stakeholder, we will route that to our billing folks to assist with that. Jimmy followed up that question, and do they need to be enrolled as an NMP or just ORP? Again, I would like to take that off the air. So if you could send that question via email, I will route that to the appropriate division for response. Carol asked, for providers holding a private practice in addition to being employed by a community agency, what's the guidance in terms of which agency address to use when registering in PAVE? So that would depend on where you're practicing and how you're practicing. You need to be enrolling at the site where you're actually providing services. So depending on where you're providing services, that would be where you enroll. If you are enrolling, for instance, or if you are practicing on your own at one location, you would, and want to bill for there, you would need to enroll there. If the community organization is billing for you separately, you would need to enroll with that organization separately at that location. Okay, next question Is this requirement for physicians and NPs who order medication in our narcotic treatment program? Our program is enrolled in Medi-Cal, but individual employees are not. If the provider is a provider type that is eligible to enroll and license, and they are not, and they are ordering, referring, or prescribing, then yes, they would need to enroll. If they, let's see, but it just depends on how, like what services they are wanting to bill for. Okay, next question is from Anne. If pharmacists can't be enrolled to a physician surgeon group, do we enroll pharmacists as an ORP only, and how do we go about that? Yes, pharmacists would enroll as an ordering, referring, prescribing provider, and you would submit an application in PAVE as an ORP provider. Next question is, so associate professional clinical counselor providers are not enrolled, correct? That is correct. Associates are not enrolled as ORP providers, only fully licensed individuals. The next question is from May Wang. The RX mandated enrollment and the ORP enrollment, do those two are overlapping with, we have most of our providers are enrolled as ORP. Will those be enrolled as fee-for-service provider? So providers that are enrolled as ordering, referring, prescribing providers are enrolled in the fee-for-service system as ORP providers. The RX mandated enrollment and ORP enrollment, they don't necessarily overlap per se, but yes, if a pharmacist is not enrolled in their ordering, referring, or prescribing, they do need to be enrolled with Medi-Cal. Okay, next question. As a hospice provider, what is my responsibility when I receive a referral from an outside provider? Is it the referring provider's responsibility to ensure they're enrolled in Medi-Cal so they can bill for their portion, or is it my responsibility to verify that my referral providers are enrolled? If you're listing a type 1 NPI on a claim, it is your responsibility to confirm that provider is enrolled. And you can use the fee-for-service open data portal to confirm that information prior to submitting the claim. Joe Turner asks, the ORP PAVE enrollment is required for both specialty mental health services and DMC ODS reimbursement eligible provider type. Is that correct? The order. I'm not sure how to answer that. I need to think about that more. I'm going to skip that for now and come back. For referral laboratories, will there be a way to determine if the referring provider is enrolled at the time the services is ordered? Yes, you can check the fee-for-service open data portal for the status of the referring provider. Will this affect DME claims? Does the ordering provider need to be enrolled for our DME claims? Yes, the ordering provider does need to be enrolled for DME claims. Dawn, what if enrollments exceed 90 days? We have a few that are taking up to 6 months. We will email through the app and PAVE and are told we are in process. Yeah, so again, we have statutory timeframes for all applications. Physicians are up to 90 days, all others are up to 180 days. There are cases where it can take a little longer because we may get an incomplete application that requires corrections, but it's all written in statute in terms of timeline. Vilma asks, I'm just going to check if they have other messages. No. Okay. If a patient is referred to a non-contracted provider through a letter of agreement, or AKO, I already did I do that one? I don't think I did. Sorry. If a patient is referred to a non-contracted provider through a letter of agreement, aka single case agreement, can we reject the LOA if the provider is not Medi-Cal certified? And how is this going to affect COC? I'm not familiar with what COC is, but if you could please send an email to DHCS PED stakeholder regarding the single case agreement, I will forward that to the appropriate division for response. Matthew asked, for Medi-Cal waiver programs, a primary doctor must sign a plan of treatment that is used to authorize the waiver services to be provided. The physician is not providing the services or being reimbursed, but are ordering them from signing the plan of treatment. Does the signing physician now have to be Medi-Cal enrolled? Yes. Any individual that is being listed on a claim needs to be enrolled in Medi-Cal if they're ordering, referring, or prescribing. Elizabeth Park asked, if pharmacists can't be enrolled to a physician, did I already answer this? If pharmacists can't be enrolled to a physician surgeon group, do we enroll pharmacists as ORP only? And how do we go about that? Yes, you enroll them through PAVE, and they do need to enroll as ORPs. Okay. Providers who are already enrolled as individual corp, do they still need to enroll separately as ORP? Their individual MPI should be linked as ORP. If they're already enrolled as an individual billing provider under their type 1 NPI or as a rendering provider, no, they do not need to enroll separately as an ordering, referring, prescribing providers. The answer is no for that. When full enrollment is in effect, how much advance notice will we receive? 30, 60, 90-day countdown. Some pharmacies are rejecting claims for non-enrolled providers today. What communication can be provided to pharmacies to accept prescriptions until full enforcement? So enforcement information will be communicated by the appropriate division. This update is just to the enrollment requirement for ordering, referring, prescribing providers. In terms of claims enforcement, I don't have additional information for that right now, but that will be disseminated by the department when it's available. Okay, Shelby asked, how do you find if the providers are registered and what each provider needs to do? You can go on the fee-for-service open data portal and check the status of any type 1 NPI there. If you see that a provider is not enrolled, then I would encourage them to submit an application to enroll as an ORP provider as soon as possible. April asks, you have stated that denials for this won't take place immediately, but for sites that have already received an audit for these, does this July 23rd date negate that past DOS that were audited? No. So this update is simply to the enrollment requirements for ordering, referring, prescribing providers. So this doesn't change anything having to do with an audit that you have already received. What is the correct application of fully enroll in Medi-Cal? The correct application is on the PAVE portal. It will guide you through what correct form to submit for your provider type and the billing that you intend to submit. Okay, Letty asked, to confirm, only a fully licensed physician can submit Medi-Cal app, not a resident trainee with a postgraduate training license, correct? An individual with a postgraduate training license may submit an ordering, referring, prescribing application to enroll as an ORP provider. It's not just fully licensed physicians, but it isn't, so associates wouldn't enroll as ORP providers, but PTL providers may. Okay, next question. Does the ORP provider enrollment initiative new requirement, it's not a new requirement, supersede the caveats outlined in all plan letter 22013, which allow MCPs to utilize non-enrolled providers for ER referral services under letters of agreement and continuity of care provisions? Again, we are not speaking to managed care and those requirements. This is updating the requirement for enrollment as an ordering, referring, prescribing provider in fee-for-service Medi-Cal. This does not change any of the information or caveats outlined in that all plan letter, and I would defer you to managed care for that question. Xavier said, as of 9/27/25, the ORP website to validate enrollment has been discontinued and advised to verify enrollment via CHHS Open Data Portal. We have identified that not all providers listed on ORP are listed on CHHS. Are you able to provide insight to this change or guarantee that the ORP provider's enrollment will be able to be verified? So the previous ORP provider lookup tool displayed inaccurate information, and that it displayed providers who were only enrolled as Medicare as ordering, referring, prescribing providers, and thus gave false information, making it seem as though a provider was indeed enrolled as a Medi-Cal ORP provider when they were not. Providers that are listed on the Open Data Portal under the CHHS Open Data Portal are actually enrolled in Medi-Cal as ordering, referring, prescribing individuals. So yes, I can confirm that the information in that portal is accurate and reflects who is actually enrolled in Medi-Cal. May Wang asks, most of our providers are already enrolled as ORP and we are billing their services as FQHC out of those clinics. Do they still need to be enrolled as fee-for-service, or the ORP enrollment is already satisfied with the mandated enrollment? The ORP enrollment would be sufficient at an FQHC. Will the webinar organizers send a transcript of the Q&A to attendees, please and thank you? Yes, we will send a Q&A document that goes over all the questions and answers we have outlined during the hearing. Randy asked, once a provider is enrolled, will the enrollment be retroactive for claims within timely filing, or does the enrollment have an effective date? All ordering, referring, prescribing providers are given a retro effective date 1 year back, subject to the status of their license. So if a newly licensed individual enrolls and their license wasn't in place within that year window, then the effective date would be the date of the license. But in all other circumstances, or providers are granted a retro effective date 1 year back. Sonia asked for health centers. They are being directed to enroll providers as rendering providers in PAVE, yet the rendering provider definition and enrollment workflow within PAVE appear to be structured around providers operating as sole practitioner, private practices, or those affiliated with Medi-Cal groups. You may not be submitting the application correctly. So Sonia, if you'd like to email DHCS PED stakeholder at dhcs.ca.gov, I can have enrollment staff assist with figuring out how to correctly submit an application. Barbara said, PAVE only works for nonprofit agencies. So how does a for-profit entity enroll in PAVE? So enrollment in PAVE is not kind of put into buckets like nonprofit and for-profit. A for-profit entity would submit an application just like any other entity. So you would submit that normally. Okay, May submitted put a link for the Open Data Portal again. We are a non-FQHC, just a CBO nonprofit, but we provide ECM to Medi-Cal members as a type 2 MPI provider. We refer members to services like medically tailored meals and homeless navigation centers. We also help order DME. Do these rules apply to us? No. So this is only for ordering, referring, prescribing enrollments. And so a CBO would not be, or the providers they work with would not be subject to this requirement. Are there specific enrollments like Medicare? For example, the provider can be ordering MD for home health, hospice, DME, et cetera, or it's enrollment for everything. The enrollment is by provider type, so a physician would enroll as a physician and bill for physician services, and likewise for other provider types. We said we are an NPA and have contracted practitioners. Some have NPI already, but under their private practice address or an old address. Which address would they update it to? Their home address or the address of the school they're working with? The provider can decide which address they'd like to put in their application. Yeah. Next question, in terms of the lag time between the date of ORP submission and date approval, can a provider obtain reimbursement? Again, ORP enrollment is retroactive to 1 year. Vilma said, we have a high number of providers treating our transgender population on an LOA basis. They do not have any interest in applying for the Medi-Cal provider ID number. If they can't prescribe, this will affect patient treatment. Do we reject treatment as they can't prescribe? So this is a federal requirement. We're required to have all providers who order, refer, prescribe, enroll with Medi-Cal. I'd like to hear your concerns by email so we can properly address them, Vilma. So if you could reach out to DHCS PED stakeholder, I'd be happy to engage on that further. If a member is requesting continuity of care through an LOA or senior case agreement to a provider who is not Medi-Cal certified, the provider may not be able to prescribe. This would cause concerns for COC should the COC be denied for that reason. Again, if a provider is being listed on a claim, they have to be enrolled in Medi-Cal. If a clinician works at an agency and bills Medi-Cal, but also has private practice, should they enroll under fee-for-service or do they need an application for ORP? If they're already enrolled in fee-for-service, they don't need to enroll separately as an ORP provider. Does a physical therapist get enrolled as an ORP? They may if they are ordering, referring, or prescribing. Zubin, I apologize if I'm not pronouncing that correctly. We heard a comment that assistants and trainees do not need to enroll. Do medical students also fall within this category? Correct. Trainees and assistants, associates don't need to enroll. However, the postgraduate training licensees can enroll as ORP providers. If an APP's NPI shows on a claim but is only an ORP, what is the result of the claim? They will bill under a supervised physician. Associates cannot be enrolled as ORPs, and the supervising physician would need to be listed on the claim, and they would need to be enrolled as an ORP provider if they're not otherwise enrolled. Okay, next question. For FQHC organizations, all providers are enrolled in PAVE as ORP linked to our group. Do we have to submit an additional enrollment application to ensure we are getting reimbursed? For hospitalists, we enroll them as individual providers. Since they provide services at the hospital, do we also have to enroll them as ORP? No. If they are already enrolled in fee-for-service, then they do not need to enroll separately as an ORP provider. Okay. Next question. Does this only apply when Medi-Cal or Medi-Cal HMO is primary care? Or does this apply even if Medi-Cal is secondary? This applies to any provider that is ordering, referring, or prescribing to Medi-Cal members. Does this apply to MHRC and adult residential services? Again, any provider that is ordering, referring, prescribing needs to be enrolled as an ORP provider with Medi-Cal. If a staff member does not update or maintain their ORP application information over time, are there concerns or risks? E.g., working in San Mateo, when I submit the application years later, take a position in San Francisco County. In the future, would PAVE compare address of record versus address of claim service? So if you have moved, then I suggest logging into the PAVE portal and updating your information accordingly. You can also re-enroll at a new location if that's necessary. Can DHCS confirm whether this provider data set includes ordering, referring, prescribing only providers, and how frequently the data is refreshed so organizations can rely on it for compliance monitoring? Yes, any individual that is enrolled as an ordering, referring, prescribing provider is included in the Cal HHS open data portal, and it's updated monthly. Is there a reference how-to sheet for organizations, clinics to add rendering providers? Also, please clarify, can a unique NPI be a rendering provider within multiple clinics? And then Jenny, one of our branch chiefs, shared instructions for submitting an ORP application are linked there. Also, please clarify, can a unique NPI be rendering provider with multiple clinics? Yes, a rendering provider can render to multiple groups. There are instructions on our website. I don't have them handy right now, but we can provide those in our Q&A sheet for how a group can add a rendering fee-for-service provider. We have really good job aids for that we can provide. Barbara asked, is it an accurate statement that the enrolling supervisor of interns must be enrolled as the prescribing provider? Yes, correct. Jody asked, has DHS officially announced a delay in implementation of the type 1 ORP enrollment requirement that was to become effective 6/26? If not, when will that announcement be out? Spencer answered that question via chat, so I'll leave that for folks to review. While claims may eventually be denied, they will not be denied on July 23rd. This is just updating the actual enrollment requirement on our bulletin. Matthew asked, do ordering nurse practitioners and physician's assistants have to be Medi-Cal enrolled if the doctor or clinic they are working under have Medi-Cal MPI? Yes, the licensed provider has to be enrolled if they're ordering, referring, or prescribing for Medi-Cal. Sonia asked, for FQHC employed providers, is ORP and only enrollment sufficient or is separate rendering provider status required? No, they would need to enroll as an ORP provider. If they are enrolled separately or affiliated as a rendering with another group, that's also sufficient and they wouldn't need to submit a separate ORP application. Stephen asked, for a registered nurse, would it be appropriate for the RN to enroll as an ORP versus any other PED provider type? Registered nurses are not currently part of the provider types that we enroll in fee-for-service. Vicky asked, for Medi-Cal RX, is this a separate requirement because of a previous bulletin says providers must be enrolled June 26th or claims will not be processed? So again, the claims edits will not begin on that date, nor will they begin on July 23rd. This update is just updating the bulletin requiring folks to be enrolled as ORP providers if they wish to order, refer, prescribe to Medi-Cal. I think I already answered the QHC one. Vicky said, did you say pharmacists must be enrolled in PAVE as type 1 individual MPI? Yes, that is correct. A pharmacist would enroll in PAVE with their type 1 MPI. Just want to confirm, are there any further action needs to be taken if the provider is already enrolled in fee-for-service as an ORP? No, there is no further action that you're required to take if the provider is already enrolled as an ORP or rendering or any other provider type in fee-for-service Medi-Cal, and you can check that on the Open Data portal. If a pharmacy processes prescription claims from a non-Medi-Cal prescriber, will those claims be subjected to recruitment or clawback? I would refer you to the KMS Telephone Service Center on billing and claims questions. You can find their contact information on the Medi-Cal provider portal. In follow-up to earlier comment about associates and trainees not needing to be ORP enrolled, what is DHCS's definition of associates and trainees in this context? I don't have a definition, but generally in the case of like LMFTs, LPCCs, LCSWs, they all have associate level providers that are trainees. So that's what I'm talking about when I refer to associates and trainees. Minetta asks, for DME application re-enrollments, is it becoming standard practice for the applications to be referred for comprehensive review as part of fraud prevention and thus taking closer to 6 months? It's not a standard practice. We will refer a provider if there are elements of the application that we wish to confirm or we need additional information. First, I asked, I was told by a Medi-Cal representative that our claims should be flagged with RAD code 558 in the RA remittance advice when they are getting paid. However, they are not showing as RAD code, even though we pulled some examples. Will this be updated soon to reflect the flags and alerts? Again, this is a billing claims related issue. I would refer you to the Medi-Cal provider portal where you can find information from Telephone Service Center, and they can assist you with that question. Can you list the link to the provider registered list? Where do we check for the registration of providers? And so Spencer provided the Open Data Portal link. You can check the status of a provider there. Ryan asks, sorry if this question was already asked, but is there a delay from the time a physician enrolls and when they show up on the portal as being active in the program? There can be a slight delay. The Open Data Portal is updated monthly. But you do get a letter in the portal confirming that you have been enrolled. So you can use that interim to confirm your status. Once a provider's application is approved and enrolled and paid, how do we find out what their provider identification number is? So you would get a letter from the KMS division with that information. Will these questions and answers be shared with us after the webinar? Yes, they will be shared. We will send out via listserv, which is how you got the notification of the hearing. We'll send a question and answers sheet that will have all this information on it. Next question, county eligible licensed staff do not bill individually and historically have not managed their own Medi-Cal enrollment. Are they expected to complete PAVE enrollment under their individual type 1 NPI? If any of the licensed staff are ordering, referring, prescribing for the county, then yes, they would need to submit an ORP enrollment application. For providers providing care within 2 different counties, do they need to be enrolled separately for both Alameda and San Francisco? ORP enrollment is non-location specific. So whichever location they wish to enroll, that can be where they enroll. Rebecca said individual corp has an NPI-2, so the NPI-2 is currently Medi-Cal approved, not under the individual NPI. The NPI-1 is affiliated rendering under this corp. Do we still need to enroll as an ORP separately? No. If the type 1 NPI is enrolled as a rendering provider and affiliated either with an individual corp or a group, that enrollment is sufficient for ordering, referring, prescribing. What evidence of successful enrollment should be provided to county MHPs? Some staff received a letter in paid portal that communicates enrollment, but others do not. Some counties simply have the applicant submit a PDF copy of the application. Is the open data portal an accepted source of evidence? Yes, the open data portal does show providers that are indeed enrolled in Medi-Cal. How long is the enrollment for? So all providers are enrolled for 5 years and subject to revalidation after 5 years. The department will notify you if you're subject to revalidation after you submit your application and are enrolled. Brea asked, will services prescribed under the HCBS waiver programs be affected by this update rule, such as home health agencies staffing the services and billing to Medi-Cal? If there are any providers listed on your claims that are ordering, referring, prescribing, then yes, they would need to be enrolled as an ORT provider in Medi-Cal. If the organization nonprofit has not completed the paid application, can the staff member, say LCSW, still complete their application to have an active paid portal? Staff can submit an application as an ordering, referring, prescribing provider separate from the group that they order, refer, prescribe to. Okay, there's a link to the open data portal. Amanda said, hello, I'm curious how this requirement aligns with beneficiaries' right to choose their own PCP providers, specifically for those of us working in the waiver program. This is a federal requirement. The state is required to ensure that all providers are enrolled in Medi-Cal as an ORT provider if they're ordering, referring, prescribing. So there's no leeway on that. We have to make sure that we align federally with their requirements. And that's what we're doing with this update. For the paid portal, do practitioners use the local LEA name and address? No. If a provider is enrolling as an ordering, referring, prescribing, they need to enroll under their own name. Are naturopathic providers eligible to enroll if they're ordering or referring? I would refer you to the applications by provider type webpage on the PED webpage, and that shows providers that are eligible for enrollment as ORT providers. Amanda said, I apologize if this question has already been answered. For school districts, do SLPs have to enroll if they are not going to be an ORT? If the SLP is not ordering, referring, prescribing on behalf of the local education authority, then no, they would not need to ORT. But if they are ordering, referring, and prescribing, then yes, they would. Will the ORT provider enrollment enforcement retro back to previous submitted claims? I would refer you to, again, to the CAMUS division on that, because that's a billing and claims issue, and PED doesn't have information on how that will actually be enforced at this time. Let's see. David said, same kind of question, confirming that FQHCs may enroll providers as ORP only and that ORP is valid type 1 MPI status. Yes, that is acceptable. Additionally, providers with a rendering status in PAVE, that is also acceptable for the purpose of being listed on a claim as an ordering, referring, prescribing provider. Will providers need to revalidate their enrollment after a certain number of years pass? All providers are subject to revalidation every 5 years, and the department will notify providers when they are subject to revalidation. Marina said, you mentioned it being retroactive 1 year. Does that mean if a provider is waiting for their enrollment to be processed, the claim will not be denied? So I would recommend waiting to submit claims until a provider is enrolled. Because if a claim is submitted and the provider is not enrolled as an ORT provider, it will be denied. Barbara said, I respectfully disagree. We applied as a child provider in PAVE and was unable to register this type of provider due to our tax status, the type of service being provided. I would love to discuss this further with you. Yes, Barbara, if you, oh, and Jenny already responded, but we're happy to assist. If you could please send an email, or no, not send an email, submit an inquiry in the link that Jenny provided, we can help you with that. If an occupational therapist originally put no prescription in SCIS, can they go back and change it once the prescription is provided? And if so, how? That is a billing claims question. And so that would not fall under the purview of Provider Enrollment Division. I would refer you to the Medi-Cal Provider Portal to get information on that. Okay, how do we review and validate provider Medi-Cal enrollment if they retire and is moved from the Cal HHS listing? If a provider is not listed on the Cal HHS Open Data Portal, they are not enrolled as an ORP provider. If a provider is already California licensed and they get this message, do you have an application in process with the California Department of Public Health? Yes, no. Would they just respond no? I don't have any context for that, so I'm not sure how I would answer that. I'd be happy to engage further in an email if you'd like to send an email. I'm not sure how, I need more context for that. Just a clarifying question, in which scenarios would ORP enrollment be sufficient versus Medi-Cal? If a provider is ordering, referring, prescribing, or enrollment is sufficient. If they wish to direct bill, then they would need to enroll in PAVE fully and not as an ORP provider. Okay, that's been answered. I'm just going through, we're starting to wrap up here. Will Medi-Cal retract payments on payments with RAD 0558? That's a billing question. You can reach out to Provider Portal, KEMIS on that, and they can assist. When we hire a new provider and they cannot find their verification letter, how do we get a printed verification of their PAVE registration? You can verify their status on the Open Data Portal, and that's sufficient for verification of their enrollment status. If an MP or PA has Medi-Cal MPI and signs an order, does the MD they are working under have to also have a Medi-Cal MPI? If so, how do we determine the name of the MD the MP PA is working under? If a provider is ordering, referring, prescribing for a Medi-Cal member, then they would need to be listed on the claim and they would need to be enrolled. Okay, that one has been answered. Please. Okay, there's that. I'm just checking if we have any other ones. If a provider changes their practice location within the same clinic, do they need to update their location and change their ORP application? No, ORP enrollment is not location specific. Okay, that's been answered. That's been answered. Okay, that is it for chat questions. Are there any verbal questions?
Katie, yes, we do have one. Hand raised, Elizabeth Ortiz. Elizabeth, I will go ahead and request to unmute now. Oh, it looks like she may have dropped off.
Did it? Yeah, the chat questions did take pretty. No other.
I do not see any other hands raised at this time.
Okay. I'm going to just hop back over to the chat one more time and see if we had any other last questions. May Wing asked, if an MD is not ordering, prescribing, and referring, but is the MD supervisor for PAs, will they still need to be enrolled? Yes, they will still need to be enrolled. Okay, I think that is it for questions and answers. I have a couple more reminders to go over. Renee asked, what is the accurate listserv to receive notifications? Staff, could someone please list the link to sign up for the listserv notifications in the chat so folks can sign up for that? Okay, so for any questions that were not answered today during this hearing, please note we will address those questions along with all other questions submitted to us in the chat box or by email in a frequently asked questions document that will be posted on our website at a later date. As a reminder, any comments or questions not shared during the hearing can be sent via email. All comments, feedback, and/or questions must be emailed to DHCS PED stakeholder at dhcs.ca.gov by 5 p.m. today for consideration for the final version of the regulatory provider bulletin. Please make sure you reference your name and organization if you're affiliated with one, and the provider bulletin in your email. We will be leaving the chat box open for the next couple of minutes so you can copy any of the links we provided for our hearing today and add any last minute comments or questions. Thank you, and that concludes our hearing. We appreciate your participation. Thank you. This is now adjourned.